Welcome to the Dairy News and Views podcast, a production of the Iowa State University Extension and Outreach Dairy Team. Our podcast covers current educational, research, and industry tools available for your operation to manage healthy cows and calves while producing the highest quality dairy products.
So welcome to Dairy News and Views from the ISU Dairy Team, your trusted source for timely updates, expert insights, and practical tips for the dairy community. I'm your host, Jen Bentley, Dairy Field Specialist with ISU Extension and Outreach, along with our Extension veterinarian, Dr. Phil Jardin, and Gail Carpenter, our State Extension Dairy Specialist. So whether you're on the farm today, in the barn, or on the road, we're glad you're tuning in. And so in this episode, we're going to be joined by a guest, Dr. Allison Vanderplatz, a postdoctoral associate, veterinary field services at Iowa State University. And today we're going to be highlighting an upcoming and exciting hands-on opportunity for our dairy consultants and producers focused on calf health and early disease detection. So welcome to the podcast, everybody.
Thank you, Jen.
Happy to be here.
Thanks for inviting me.
Yeah, so Dr. Vanderplatz, you're going to be leading a demonstration on lung ultrasound, kind of a cutting edge technology that started to come out here in the last few years to try to improve calf health and diagnose respiratory diseases a little bit earlier. So we're going to be talking about that here today on our podcast. But before we start, Dr. Jardin and Gail, you want to give us a little insight on what this dairy consultant meeting is coming up in November?
Sure. So this will be our second one. We did it last year. Last year we did it on biosecurity. We had the biosecurity trailer there. We had it in Ankeny. Both years we had it before a football game, the Friday before a Saturday tailgate and football game, which we're going to do again this year. But this year we're moving it to the Iowa State Dairy. We're going to use the classroom there, along with use the dairy as a laboratory. Brett Ramirez, along with Pat Gordon, are going to be talking about ventilation systems. Dr. Ramirez is a professor in the ag engineering department and really an expert more on the poultry and swine side, but I think it's really great what we on the dairy side can learn from those folks. So we're going to have some lecture in a room, it's a classroom, kind of an informal setting and discussion. We're going to learn a little bit about ventilation. And then we're going to actually look at the calf barn there at Iowa State, and they're going to show us how they smoke a barn, and we'll get to some real life experience there about things they've seen on this farm, on the farm here, but also things they see in general, and maybe what some of the consultants can add to their practice repertoire of things they can do on a farm to help solve ventilation problems.
Yeah, we think this will be good for nutritionists. We're not talking about nutrition in particular, but we know that management really ties in with a lot of nutrition problems and calf growth problems that we see on dairies. So we think if you're a nutrition consultant or if you're a veterinarian who's working with dairy farms, we think all of anybody who's working with dairy farmers could benefit from this hands-on demonstration. We're really focusing on how does this work out in the real world? We know that people don't want to sit and be PowerPointed to death, right? So this will give people an opportunity to get their boots a little dirty, biosecurely though, right? We'll make sure that we have a boot wash station. We did learn about that last year. But yeah, it'll be very hands-on. So it's a pretty exciting topic, I think. And of course, producers would be able to get a lot out of this too. It doesn't just you don't have to leave this to your consultant. If you want to learn more about troubleshooting ventilation or how lung ultrasounding actually works, in case you want to talk to your veterinarian about it too, anybody, I think, really, if you work with calves, could benefit from our workshops.
And I'll add architects, engineers, and bankers into that mix that might be interested.
Mm-hmm. Or if you just love calves, they're cute. You'll see a lot of cute calves. It'll be a lot of fun. So I think we call it the professional development for Iowa Dairy Consultants. But hopefully people don't feel too limited by that title. Hopefully you realize if you're somebody who loves calves and wants to make sure that they're healthy, this will be a good opportunity for you.
So what we're planning to do while we're down there, we're thinking that one group smoking the barn and another group will be with Dr. Vanderplatz, getting a demonstration on how lung ultrasound works and what the images look like and and how that process works.
Yeah, so I don't think we said the date yet. So that's no
Oh,
Friday.
that's great. Yes.
I should probably put that plug
Just
in there.
come every day. Just
yeah,
kidding.
right. So Friday, November 21st is the professional development day. So that's in the afternoon. I believe you have it starting at 1 and
Yep.
then concluding with the ice cream social. So ice cream,
Yep.
if that
We're planning
entices
3
anybody,
hours.
right?
There's 3 hours of continuing education that have been approved by the Iowa Board of Veterinary Medicine, and I believe we're getting it through ARPAS too, right?
Yep.
Yes.
Yep.
So we'll have to get some good honest to goodness CE there, and then of course I like you brought up the ice cream social. It's going to end at 4:00 with the animal science or the dairy science club, right?
Yes.
Ice cream.
Yes, it's going to start. The professional development will end at 4, and the ice cream will start at that point, maybe a few minutes earlier if people are hungry. So yes, Dairy Science Club is going to be providing ice cream for us. If you're an alumni of Dairy Science or the Dairy Science Club here at Iowa State University, you're familiar with the ice cream sales that we have. So we'll have some students there serving us ice cream. Still accepting requests for flavors. I don't think I've told them officially what flavors we're doing yet. So if anybody has flavors they want to see there, let us know. We'll put in a special request.
Or do we have? Is it a list that we check off the box on?
I mean, I think they have a lot of flavors, right? They've really gotten creative over the past few years. They've got actually, as we're recording it, today is Wednesday, which you know what that means. That means ice cream sales in Kilby Hall. I know today they're having birthday cake, chocolate, Oreo, and vanilla. They've done some like Twix and Kit Kat, and they had like a mango one recently I saw they were experimenting with. So I think if you can dream it up, we'd love to hear it.
I know it was a big hit over at the Forage Days. That was a
yes.
very beautiful day, and when you brought that ice cream over in the cooler, it was perfect for that afternoon.
Yes. And it might be a little colder in November, end of November than it was in August for our forage field day, but we'll be inside, and it's never a bad time of year for ice cream.
That is correct.
But of course, probably we should talk about what we're going to be learning about, not just what we're going to be eating.
That's what I was just going to get to, Gail. I was like, maybe we should start talking about our topic here today. So, Dr. Vanderplatz, you're going to be leading that hands-on portion about lung ultrasound. But before we get kind of into that, let's just talk a little bit about calf health and maybe some of the challenges that you see in pre-wean calves and why this is such an important topic.
Yeah, so BRD, bovine respiratory disease, is definitely one of our major disease processes that we see in pre-wean calves. And I know this is a dairy extension event, but we see that in beef calves as well. So this is not just a dairy problem. Our other major disease process is going to be calf scours. So calf scours is usually in the first 7 to 14 days of life that we see that. And then our respiratory disease hits us a little bit later, starting around 3 weeks of age. And then it can extend all the way up to weaning if we let it, essentially. So respiratory disease is definitely one of our biggest pre-wean calf concerns. And it has a potential lifelong impact on animals who are affected. We see delayed breeding with heifer calves who have BRD when they're young. We see loss of milk production. So a couple studies have corroborated like 1,100 pound overall loss of milk production. We see decreased growth, and we see delay to mature size. So it's not just a calf disease. This is something that's going to really affect her for the rest of her life.
Yeah, and I always think that's kind of a tough decision our producers have to make, right? You have an animal with a respiratory disease and really don't want to get rid of that animal, but sometimes you have to make that decision about should we cull that heifer a little bit earlier because she may not reach her full potential, and kind of look at it that way too.
I remember doing a postmortem on a cow once that the owners were disappointed in. She's only given about 20,000 pounds of milk, and she thought that she'd be a 30,000 pound cow, but she looked healthy. And anyway, she ended up dying, and they thought she had hardware because it looked like she was painful in her chest, but she ended up having a big abscess in her lungs that probably had started when she was a calf. So it's probably one of those things that the calves just get a little bit less lung capacity. They just don't produce as much milk as they can, just not quite as healthy as they are the rest of their life. It's not just once they recover, there's still some damage that's been done.
We often see in freshening heifers when they first calve in, if they've had pretty severe respiratory disease as a calf and they've made it to that freshening, a lot of them, especially with any sort of stress, environmental stress, handling stress, stress of being in a milking pen for the first time, a lot of them will come back. It'll come back on them. And they have a really poor start to their lactation career as well. So it's, yeah, the overall losses and stuff, but it's an animal health issue and it's also an animal welfare issue. We don't want our first calf heifers calving in and then having horrible respiratory disease because her immune system is compromised from the disease that she had as a baby like 2 years ago.
Mm-hmm. And a lot of these are preventative too, right? It kind of goes back to the ounce of prevention is worth a pound of cure, which is why we wanted to tie in the whole idea of BRD detection and lung ultrasounding with ventilation and talking about troubleshooting some of those ventilation issues that we have because it is definitely something that pays off in the long term. I give a lot of when I give nutrition presentations on calves, I always talk about you can't outfeed bad management, right? And it doesn't matter how good of a job you're doing with your feeding protocols, how much you're spending on milk replacer, what level of milk replacer you're feeding, all that. If your calves are poor doers because we have respiratory issues because of some facility design issues or other management issues. So that's what I'm really excited that we have an opportunity to kind of tie that whole story together with the lung ultrasounds and the ventilation.
I mean, to speak to your preventive thing, I think we need to think about those calves who have scours already are at a disadvantage. Their immune systems are working overtime from that, trying to recover from that. And then pretty much as soon as they recover from scours, we're in BRD territory now. So we do see a lot of calves who did have scours end up with respiratory disease. That's a very common pathway for us. And just like Gail said, there's a lot of things that we can do to prevent these things. If we can prevent both, that's ideal. But if we can take care of at least some of these background things, good sanitation of your feeding equipment, making sure that you're feeding appropriately product and amount, but also taking care of environment. Calves shouldn't be in super wet, humid, dirty pens all the time. Hutches need to be cleaned out daily if they're in hutches. They need to be bedded appropriately. You shouldn't be able to see concrete. You should be doing the knee test. Make sure your knee comes up dry so they're not just sitting in wet, dirty all day. Biosecurity wise, we want to avoid mixing ages of calves. So we don't want our brand new baby calves hanging out with our month-old calves who have already gone through this whole thing because they're just passing their germs back and forth. And those baby calves don't have the same immune function that those older calves do. So biosecurity is really, really, really a big one, but basic hygiene is another really, really big one. So the ventilation definitely plays into that. The feeding definitely plays into that. But it does all work together. And I think vaccination is part of it too. But we need to think about cow vaccine programs versus calf vaccine programs because a tiny baby calf isn't going to immediately respond to whatever we put in their body when we do their first processing.
So Allison, talk to me a little bit. I think a lot of people think they know, like you can tell when a calf has pneumonia, right? You know when a calf is, you walk into a barn, you hear a lot of calves coughing, you think, okay, we've got some ventilation issues or some air quality issues in here. So what is the benefit of lung ultrasound then? Why are we interested in this new tool if we can just kind of hear when calves are talking and know when they have BRD?
So part of it is I am not saying that lung ultrasound is the end all be all for BRD diagnostics. I think it's one of the tools that we have in the toolbox that has gained popularity, especially in the last couple of years, but this has been around for more than 10 years now at this point. We now have a lot more literature to actually support its use, and we have a lot more producers who are willing to try it as more of a management tool rather than a treatment tool. But I think we're all familiar with the signs of respiratory disease. We walk through the barn, we hear the coughing, we see the eye boogers, we see the nasal discharge, we see maybe increased respiratory rate, increased respiratory effort where they have that abdominal push, maybe some droopy ears, maybe some fevers if you're temping them. If you have auto feeders, you're probably going to see prolonged feeding times because while they do actually eat as much as their counterparts, they don't do it nearly as fast because they're having to balance like literally breathing with swallowing their food. So those are the things that we know to look for. And we do have good research to support that. We have actually 2 validated bovine respiratory disease scales, one from Wisconsin and one from UC Davis, that can help us identify those things and actually put a number on it, a score. But the point of lung ultrasound is to identify those subclinical cases. So everything that I just talked about, those are clinical signs. Those are things that we can see in the calf or hear as we walk through the barn. Thoracic ultrasound is meant to find those subclinical calves. So those are the ones that aren't showing us those signs, but do still have abnormal lung tissue. So that usually means that they've had some sort of infection. That lung is no longer aerated. It doesn't have air in it, and that's the point of lungs. So if it doesn't have air in it, it's not doing what it needs to do. Those calves aren't getting oxygen through that tissue, and so they have decreased respiratory capacity, which kind of contributes to just poor health and these other poor feeding behaviors. So the goal of lung ultrasound is to help identify those subclinical calves so that we can treat them earlier and potentially not even get to that clinical stage.
So walk us through how a producer would use this as far as a management tool. Is it a weekly thing? Is it a monthly tool? Kind of explain that.
Yeah, so it kind of depends on what the producer's goals are. A lot of producers who want to go all in are going to do weekly scans, and you'd work with your veterinarian to figure out what your risk age is. So maybe on your farm, the risk is at 30 days of age. Maybe on another farm, it's at 21 days of age. And so you can start to identify when you're actually finding these calves with these clinically normal calves with these lung issues, and maybe start taking a closer look at what else is maybe happening at that time. You can also use this as a monitoring tool. So let's say that you have identified a respiratory disease problem and your calves are generally looking okay now, and you just want to see, like, are we actually recovering or are they showing prolonged lung problems? So the use of this really does depend on what the goals are. And we can use this sort of as a spot check, but I think honestly the most effective use of this technique is as a regular monitoring thing. So even if it's not weekly, maybe once a month at every third herd check or something, we go through and we're looking at specific subsets of calves to help determine risk area or risk time, maybe how our treatments are working, maybe even evaluating, can we tell the difference or can we identify calves clinically earlier? Like, are we doing a good job identifying calves early? So part of the, I don't want to say issue, but challenge with this technique is that there are so many doors that you can open with it, and there are just a lot of options. So the use of it just really depends on what you're actually trying to do. If you're just trying to say, like, yeah, we have a respiratory problem and our calves have terrible lungs, it'll do that too. But the question is that really beneficial? Is that going to actually change how you're managing those calves or how you're managing the treatments of those calves?
And I can see a lot of opportunity for producers to be working with their veterinarian on this too, right? If you're a smaller dairy, maybe you're not going to invest in a lung ultrasound and be doing this every week. But hopefully you have a really good relationship with your local veterinary clinic, and maybe it's something that you and your fellow producers might want your vet clinic to invest in, because it would be able to help multiple farms in that case. So might be worth checking out as a producer, even if you don't think it's going to be something that you're going to use yourself every week. But if you want to give your vet give them a little nudge that maybe they want to get invested in this technology, this might be a good thing for you to investigate or get into. I think we're also going to talk a fair amount at this event about not just how you like logistically use the lung ultrasound, but what you do with that information. And so I think that's kind of where a lot of this will potentially tie in together, and hopefully, even if you don't think you're going to invest a lot of money into this new machine, hopefully that's something that a lot of people will get a lot of value out of with the conversation. is some of that.
One of the things I do want to just say is the ultrasound machine that we're talking about is actually the same one that if your vet uses ultrasounds for pregnancy diagnosis, it's the same machine.
Ah,
So
there you go.
really just you're creating a new pathway for the use of this technology. You're not trying to buy something new unless you're really into this now, right?
Right.
But if your vet is already doing ultrasound pregnancy diagnosis, they're using the same thing to do this thoracic ultrasound in calves. So just another option, just another opportunity.
It's a great
It's
point.
the same machine and the same probe.
Yep, same probe.
Everything's the same.
Yep.
Wow. I did not know that. That's something I learned just now in real time.
Yeah, but I agree with you like wholeheartedly, Gail. Some of my big herds would use this really as just which cat, like we have an overstock of heifers. We want to pick out the ones that we really don't want to spend our resources on to send to our calf raiser. We want to pick out the ones that have terrible lungs right now, even though they look okay, so that we can cull those and really only dedicate our resources to the calves that we want to keep in our herd. So that's one way to use it. If you want to do weekly monitoring, that's another way to use it. There are lots of options, but yeah, that's definitely something that we're going to spend some time on as we're going through the actual how-to. Because I think there are some proponents that are like, yeah, lung ultrasound, it's the thing. It's what we got. We should be using it more. But it really does depend on what your actual goals are. Because for some people, this is not going to be a useful tool.
Yeah. So what would you say some of the biggest barriers are when it comes to adopting lung ultrasound?
I think you are going to be, if your vet does not already know how to do it, there is a learning curve associated with it. So, and most vets, we learn things on the fly anyway, so that's not really a big issue for us, but you'll need to be a little bit patient while they kind of get their feet under them and figure out the technique. I think the other big barrier is that you will be spending more money on them actually doing lung ultrasound. It's not just, if you're paying hourly for your herd check, think of adding another hour to go through your calves. That's essentially what that is. But the kind of second issue is, what do we do with this information? Because we know we can do this. We know, okay, this calf has a score 1, this calf has a score 5. Is that useful to me? So I would encourage you before even just like, hey, let's buy a new machine. We need to figure out if this is actually going to be useful for us. So the barrier is really the planning. So how do we want to use this? Is this a management tool that's going to be useful for us?
I think we've hit most of the questions. Okay.
Yeah, that's what I was thinking.
I think
too.
so.
All right.
The answers to them. Not every question directly, but
Yep.
Yes. We've hit most of the topics. Yeah. Yep.
Well, so I do want to bring up, so at the IVMA meeting, Dr. Olivet spoke just a couple of weeks ago. So if veterinarians were there and listened to her, this won't be just a repeat of that talk. This will be more more of a demonstration in the lab, actually seeing it happening. Not she gave a presentation and went through it very well, and how it works. But this will be very much hands-on. Do you have in mind, Allison? Right?
Yeah, I'm gonna bring out a couple different machines so that we can kind of play with different probes and see how that might affect what calves you can and cannot see really well. But yeah, the goal is really to take what she talked about and put it into practice. So at least we can get some exposure to doing it on some calves.
And probably a benefit of consultants and producers being there is just that network of talking about issues that they're having and the challenges and kind of learning from each other too, right? Of what's working, what's not. I know every farm is different when it comes to disease challenges, but if you can bounce ideas off each other, I think that really is beneficial. And to see it in person is also a good thing.
Yeah, I'm glad you brought that up. I find that true, that when you get a group of people together that have a common interest, you learn a lot just from talking to your friends and neighbors about what's worked and hasn't worked on their farms and that kind of thing, and our practices.
And speaking of networking, if you want to stay after, spend the night in Ames and then enjoy some Cyclone football the next day, we have We're enticing you to Ames with some professional development, really to get you to the tailgate, or maybe it's the other way around. Maybe we're enticing you at the tailgate to get you to come to this event. You don't have to go to both, right? You can choose one or the other, but as long as you're down, stay Friday night. Go down, get your Hickory Park or your cornbread, or what you're smoking, get your barbecue of choice here in town. And then the next day, Saturday, November 22nd, we are playing KU. Should be a good game. Iowa State's had a pretty good season so far. Only one loss so far this year, unfortunately. Last year we were undefeated at this time. But yeah, we've had a really great football season. It's been a lot of fun to watch the Cyclones. So we will have our dairy industry tailgate and tent row. We will announce more details as we get closer, because right now we don't know what time the game will be. So yeah, as the game gets closer, pay attention for some of those details. We will be on tent row with the red and yellow striped tents. We were there last year. It was a lot of fun. We're right in the middle of the action for tailgating. We'll have food provided with some sponsor dollars, and that will be hosted in conjunction together with the Dairy Science Club at Iowa State University. So great opportunity for alumni to come connect with other alumni, enjoy some football. It'll be fall weather by that point, hopefully. Should be a nice crisp fall right before Thanksgiving. Really great opportunity to come back to Ames and do the homecoming is this a couple weekends. The homecoming is October 25th, so it will be after homecoming, but you can consider it your own personal homecoming to Ames and a nice reunion with other folks who love Iowa State and love the dairy industry.
No, I mean, I think it'll be a fun opportunity for us to kind of mess around with some ultrasound, and we do have a variety of calf ages to look at, so it'll be a fun afternoon.
Very good.
Sounds good. Well, I appreciate you all being on, and thanks, Dr. Vanderplatz, for sharing your insights and giving us a little sneak peek of what we're going to look forward to on Friday, November 21st. So I'll include the date and the link to the industry doubleheader in the notes here today, so that if you want to go check out, as those details become available, we'll have that website updated so you can check that out. So thanks for being on here today. And if you'd enjoyed this episode, be sure to subscribe and share it with your fellow dairy producers and professionals. For more resources and upcoming events and expert support, you can always visit our Extension Dairy Team website at www.extension.iastate.edu/dairy team. So thanks for listening. And until next time, stay safe, stay informed, and keep making a difference in the dairy industry. Thanks all.
This institution is an equal opportunity provider. For the full non-discrimination statement or combination inquiries, go to www.extension.iastate.edu/diversity/ext.